Hello, everyone, and welcome to another session with Rights and Responsibility is Awareness Initiative. Today, we are lucky to have Ernest Johansson, a mental health expert, to talk to us about a very important topic, anxiety. Ernest, thank you so much for being here today with us.
Thank you. I'm always glad to speak about mental health conditions or concerns because I'm very passionate about mental health and addressing mental health's ability to improve people's quality of life. So I'm very happy to talk about any piece related to mental health, and I appreciate the opportunity. So thank you. So today we're talking about anxiety. Now, it is very important to state, and this might seem, this might be something you hear a lot from me, but I say it a lot because it's important. Any mental health disorder, diagnosis, or condition is largely an extreme extension of normal human behavior and normal human thought process. And that is very true of anxiety or clinical anxiety. Anxiety serves a very primal purpose in our lives. Anxiety is designed to keep us alive in a very primal, immediate sense. Um, a lot of anxiety relates to detecting danger or risk. So if, Heather and I are having this conversation online, if one of us were in a situation where a bear would jump in our room or the room we're located in, we would have an anxiety response and then a fight, flight, freeze response. That is important because that keeps us alive. If a bear were running at me, I wouldn't be talking to it about clinical modalities of treatment for anxiety. I would leave. And so anxiety in and of itself is not a bad thing. It is a mechanism in our brains designed to make us risk averse and keep us safe and alive. And there's different types of anxiety that are relatively normal. Immediate anxiety related to immediate risk. If, the example of a bear being present and potentially threatening to us, or another large predatory animal, saltwater crocodiles and polar bears are apparently the only animals that will inherently predate on humans, whereas other large predators may attack a human in certain circumstances. Those two animals will be like human beings, yummy. So when one of those is around, anxiety keeps us safe. There's also performance anxiety or event anxiety. If many, many years ago, I was a competitive track and field athlete. Right before a race or an event, I would have anxiety, and that's quite normal. Learning how to work through that anxiety is a skill that you learn, but being concerned about the performance and valuing the performance means you're going to have a degree of anxiety, and that's natural. Stage performers, actors, singers will have some degree of anxiety, and that means they care about their performance, and that's totally natural and okay. Now, clinical anxiety is a an extension of the purpose that anxiety serves in a way that is dysfunctional or harmful. And what is anxiety or clinical anxiety? And basically, an anxiety disorder causes one to respond to an overt number of situations with fear or dread. And it might be related to a problem at work. It might be related to a task that you have to complete in work or your personal life. It might be related to fear that people may not like you or dislike you. Um, and it is disproportionate usually and for longer periods of time. Now, clinical anxiety interferes with your ability to function in your day-to-day life. You might be super task avoidant or overtly task avoidant such that you don't accomplish some of the things that you may need to accomplish or be asked to accomplish. Um, Often people with clinical anxiety will overreact to a stimulus. Um, you know, Instead of a bear jumping in your room, a squirrel might walk across your lawn, and you might have a fight, flight, freeze response to that, which would be a disproportionate response typically. And also a loss of control of your responses, be it anger or reactivity or isolating yourself. Clinical anxiety causes people to have disproportionate responses in an uncontrollable fashion. Now, all ages can be diagnosed with anxiety, and in a clinical sense, women are twice as likely to be diagnosed. However, men are very habitually, on the whole, tend to be more avoidant of mental health treatment, and that might skew the diagnostic numbers. Now, There are many, many, many different types of anxiety disorder. So I'll go over a few more common ones. And also, there are some disorders that historically were considered anxiety disorders that no longer are. So I'll start from the top. Generalized anxiety disorder. Basically, general GAD or generalized anxiety causes fear, worry, and constant feelings of being overwhelmed in a disproportionate sense to one's life conditions. And again, there is some subjectivity to that definition. Excessive, frequent, and unrealistic worry about everyday tasks, everyday events, job responsibilities, health, at-home tasks, personal relationships. It is disproportionate worry about all those situations that impacts one's ability to function in day-to-day life. Then there's agoraphobia, which often gets mischaracterized as a fear of being outside the home, and that is part of some agoraphobia, but it's really um, it is more so that people are afraid of new places without knowledge of how to escape a certain situation in those new places. So often people with agoraphobia might only feel safe at home. They could feel safe in a number of environments. And again, this is disproportionate fear that impacts one's ability to function day to day. Panic disorder, and I shall be clear about this. Some people will have concurrent manifests of their anxiety. They might have generalized anxiety disorder, but they're also prone to panics. Um, but panic disorder in and of itself is multiple unexpected panic attacks. Panic attacks often include feelings of tightness in the chest and lungs, physical responses that are a tightening and a self-protecting. So you'll see tightness and shortness in the anterior deltoid and a lengthening of the anterior or posterior deltoid, tightness in neck, shoulders, hips, hands even. And basically, um, these panic attacks uh, will be disproportionately frequent and interfere with one's health. Now, it's not considered a panic disorder if you have, say, again, generalized anxiety disorder with panic episodes. That's considered a part of the generalized anxiety disorder. Um, those panic episodes actually can be greatly helped by a mental health professional intervening and helping people reconnect with their other senses in a safe way. So you can lengthen your shoulders, lengthen your anterior deltoids, and shorten your posterior deltoids. You can breathe deeply and slow down your central nervous system in a way that will address the panic. But a panic disorder is an overabundance of these episodes. And then there's specific phobias. Agoraphobia is the only one with a diagnosis. Um, a specific DSM category, but rather fears of very specific things. Arachnophobia is common. There are some very arcane phobias as where fears of paper. I've experienced that professionally. Fears of very specific and seemingly individualized stimulus. So very specific phobias. Usually these are connected with trauma, real or perceived, associated with the object of the phobia. There's social anxiety disorder, which basically people have a huge fear of being judged harshly in social interaction and have a disproportionate fear of engaging with others. Separation anxiety, where basically usually it manifests as for a younger person with their primary caregiver, but there can be other manifests. And basically it's a severe fear of being separated from loved ones. And then selective mutism is a anxiety disorder that basically people will have other manifests of anxiety and just choose to go silent and seemingly lose the ability to verbally communicate. Sometimes people with selective mutism can verbalize or text even to individuals they need to communicate with, but it is often a response to fear of being judged, a disproportionate fear. Now, um, PTSD and OCD used to be considered clinical anxiety disorders, and a lot of the treatment is similar, but they often have very specific causes, and they're kind of seen as distinct disorders. PTSD is post-traumatic stress disorder, which is related to a very traumatic or stressful life event, which causes ongoing fear of a reoccurrence of that event and transference of or interpretation of events around the individual such that they see the event is imminent in its return. Obsessive compulsive disorder is often also related to trauma, and it's a need to control very minute factors in one's life as a response to not being helpless in dealing with a future trauma that is similar. And so, like I said, they used to be classified as anxiety disorders, and a lot of discussion around clinical anxiety will include them still, but they're no longer, they are now classified as distinct disorders. And I mean, that's something when you're talking about mental health that is important to be aware of, that like any other science, definitions change as there's more new information, and the long view tends to be towards increasingly accurate and helpful information as there's an abundance of information present that wasn't present before. But things will change over time, and that's okay. That's part of science in general. So, anxiety disorders impact roughly 12% of the population, ballpark. Um, in particular, specific phobias. Uh, Social anxiety is actually highly common, with about 7% of the general North American population affected. Um, and generalized anxiety is about 3%. And there's various smaller manifests of other anxiety disorders. The least common is selective mutism, with roughly 0.5% of the North American population impacted, usually younger people. Um, some people will grow out of the selective mutism, and usually they're in selective mutism in particular, there'll be a specific trauma, or it'll be a population that is deemed highly judged. So, for instance, there are higher rates of selective mutism in LGBTQ teens because the social judgment of LGBTQ people is often more negative and often more challenging for the individual to negotiate, and selective mutism is relatively common in that population. So, what are symptoms of anxiety? Um, and again, some of these are natural extension of what your body does in an emergency situation where you need to survive, and you perceive that your physical well-being is in immediate danger. So, um, and keep in mind, for clinical anxiety, there's an overabundance and a longer duration or frequency and an undue presence of these feelings. So, feeling panic, fear, dread, and uneasiness. One of the analogs that you'll hear said in a lot of mental health fields is you hear your shark music. So, like the 70s movie Jaws, you hear the dun dun dun, or I probably did it wrong, but the feeling elicited by that type of music will be present in your head. And when you're actually in danger, it's very justified, but when clinical anxiety, it's disproportionate. Feeling on edge and irritable, which is particularly damaging for social anxieties because it makes you not function as well socially. Um, but basically, taking every slight perceived affront as an attack is part of social anxiety or other anxiety disorders. Um, and just a high rate of irritability and just ready to have this panic, fight, flight, freeze response disproportionately. And then uncontrollable obsessive thoughts. There are many mental health disorders and conditions that have such feelings, but it is it is very much present. Negative thoughts, perseverating, meaning focusing on one thought, and catastrophizing, focusing on potential negative outcomes, is very common in clinical anxiety. And then difficulty concentrating, because um, when one has a condition of clinical anxiety, there are these negative thoughts, these thoughts of fear, thoughts of panic, thoughts of worst case scenario, catastrophizing thoughts that your brain is occupied by. So concentrating on the information and tasks that you might have right in front of you is very, very hard. Physical symptoms include restlessness. And again, there's many conditions that include restlessness, heart palpitations. And I've seen it as a mental health professional, I've seen it happen where someone would be having an anxiety attack, and the initial thought was they were having a heart attack. And it's just heart palpitations can be very strong there. Shortness of breath comes from kind of the same place. As mentioned before, muscle tension, this tightness where you're like self-soothing. Cold and sweaty hands is very common. Dry mouth, and I don't have dry mouth because I'm having a panic attack. I have dry mouth because I'm talking a lot, but no problem. And then nausea. People can feel like vomiting or what have you when they're having an anxiety episode. Tingling in hands and feet is also common with anxiety, be it an episode or as an ongoing condition. And sometimes even the tendons in your hands and feet will shorten because of constant tightness and constant being on edge. And someone who's experienced prolonged periods of an anxiety disorder, be it generalized anxiety or what have you, there'll be loss of range of motion in the hands and feet. So the hands won't be able to open fully without pain or without being manually moved. And same with the feet. The plantar fasciae and the tendons that control the toes will shorten. So there's kind of a curled foot. That's an extreme example is with prolonged anxiety, but nonetheless, that is the case. And then in particular, anxiety disorders involve insomnia. If your brain is always perceiving danger, our bodies are designed to survive immediate danger. Our brains are designed to survive immediate danger. So if you have a heightened sense of danger or risk, it's going to be harder for you to fall asleep. Now, the causes are, I, like with other mental health disorders, the causes can be, they're not as fixed and not as known. There is a constitutional chemical imbalance that can cause heightened anxiety. Um, if exposed to prolonged stressful events, be it a situation where your basic needs aren't met, i.e., homelessness, or if you're surviving a super high stress situation like surviving in a war zone, it can actually change the physical makeup of your brain such that um, your amygdala becomes much more engaged if you have heightened, legitimate things to be fearful of. And it can actually just continue being overactive once those stimulus are gone. So, in other words, if someone survives a war zone and then is, you know, through whatever factors, is 10 years removed from the war zone and relatively safe, their brain will still be adjusted for the war zone. And then there's a genetic component, biological family um, can pass on clinical anxiety, especially parents, siblings, grandparents, etc. A first degree relative are often indicators of the potentiality for clinical anxiety. And then, and this is a little redundant to the brain changes factor about your amygdala, but long-term exposure to stressful events causes in long-term features of anxiety. So again, homelessness, war zone, extreme poverty, or situations of abuse, like someone who lived for years in an abusive relationship and has left the relationship and is doing work to recover, may still have clinical anxiety because of the changes that causes in one's brain. Now, as with other discussions, I'm not going to spend too much time on the diagnostic feature, um, because I think it's very important to talk to a family doctor and a mental health professional. Like with many, many, many conditions, it's very easy to Google some symptoms and be like, I have it. And realistically, that's not very helpful. But the truth is, anxiety is part of human existence. It serves a purpose to keep us alive in danger, to keep us focused and motivated when there are high consequence events in our lives. And that is part of the human experience. Everyone is going to experience anxiety at some point in their life. And the differences between normal anxiety, quote unquote, and clinical anxiety sometimes are relatively subjective. And how intense they are and how long they last is a significant factor. How proportionate they are to your life events. Do they impact your day-to-day life when there isn't a traumatic force in your day-to-day life? And also how third parties, qualified third parties, not the neighbor who doesn't like you, but qualified third parties might observe how proportionate your reactions to certain stimulus are and might suggest you have clinical anxiety. Now, I don't want to go too into the diagnostic treatment because I feel very strongly that the diagnostic component should be left to professionals. If you're concerned about it, by all means, see a professional. I don't want to dissuade anyone from that, but I think it's irresponsible to do amateur diagnosis, not very helpful. So, there are a few treatments for anxiety. One is medication, and there's three basic strategies for medication. One can use antidepressants. And antidepressants, because there's a lot of crossover between anxiety and depression in terms of impact on mood, antidepressants, when used in to treat anxiety, essentially, without going into the science of it, but more kind of in accessible terms, they raise the basement of your mood to a certain extent. And that keeps people from having disproportionate fear. Um, and there is some experimentation involved, but in terms of your medical provider and the patient, figuring out what the right dose of what the right medication is. But basically, long-term antidepressants can help with chronic anxiety conditions, generalized anxiety disorder being a good example. Benzodiazepines can help with anxiety. They tend to be used as what's called a PRN, which is a medication that is used as needed. Um, and Now, benzodiazepines are potentially addictive and do have narcotic street value and can be abused narcotically. So one has to be very careful when prescribing them and then using them. Um, and with PRNs, there is the chance of overusing them. And certainly there are some individuals who have anxiety such that benzodiazepines are just a normal part of their medication regime. But they tend to be used as PRNs. And so the most common ones are they're hard to pronounce. Clomazepam, diazepam, lorazepam, and I have it written down because I struggle to pronounce this one, alprazolam. And basically, they'll be given a dose. You'll be given a dose. It slows down your central nervous system. Sometimes people actually will fall asleep, and an off-label use is as a sleep aid for people prone to anxiety-borne insomnia. Um, and they slow down your central nervous system such that that sense of fight, flight, freeze is muted, and they're not having an anxiety episode. And also beta blockers are used in the case of anxiety dis episodes because they address some of the physical symptoms, the muscle tightness, the rapid heart rate, the heart palpitations, shaking and trembling. So they address some of these physiological manifests of clinical anxiety episodes. Now, medication is generally not all of it. Psychotherapy, in particular CBT, can be used to treat anxiety disorders. And what CBT does is allows someone to have what I would say is a pilot's view of their thought process and therefore take more control. So, in other words, if you've undergone CBT and you're finding yourself having an undue fear reaction to whatever stimulus, you can walk yourself through kind of taking control of those actions and stay away from your reactive brain centers such that you're not having an anxiety state. And then exposure therapy, there's some controversy around this, but minor exposure to triggers for anxiety episodes can normalize the exposure such that you have more capacity to manage that. You have to be careful with this, but when done with professionals, it can be helpful. Now, there's also preventative components. Um, and basically, if you live in a way that is good for your mental health, it can help with anxiety disorders. There's not like any sort of one preventative factor, but if you get lots of exercise relative to your ability and interest, if you have social relationships with loved ones that are positive and peer groups that are positive, if you have community, if you have purpose in life, time outside, healthy diet, good sleep hygiene, all of those things can be preventative factors for anxiety disorder. Now, um, if untreated, anxiety can cause a dysfunction in work and social aspects of life, such that people are unable to work to their full capacity or even job loss. Substance use disorders, in particular alcohol, are very common for people with anxiety. Now, alcohol in particular is a double-edged sword. When under the influence, it quote unquote takes the edge off, which lowers anxiety, in particular social anxieties. However, long term, it's a depressant to your central nervous system, which makes you more prone to anxiety longer term. People with anxiety also tend to have a comorbidity with major depressive disorder. It's not an uncommon diagnosis pairing, and undergoing treatment for both. There's a lot of overlap in the treatment for both, but it's something to be aware of. And then frankly, people with anxiety are more likely than the general population to end their life via suicide. So suicide prevention is a huge piece of, helping someone with anxiety. And the major red flags of suicide prevention are a plan to end their life, a loss of focus in the future, a means to end their life, and an ability to carry out those means. And almost sometimes when people have set their mind to commit suicide, there's almost feelings of giddiness or euphoria because their problems are over. So it's something to look out for if you have a loved one that you may feel has clinical anxiety. And frankly, the physical stressors of anxiety put one at more risk for heart attack and other cardiac events. Now, for people who have clinical anxiety, social supports, be it support groups or it can be communities, be it a religious center or something that centers around an activity that's a positive activity for the individual, can function as support groups as well. Although specific support groups for those experiencing anxiety are generally good. Um, Stress management tools, being mindful, engaging in mindfulness practices, or something like meditation is very, very helpful. And actually, people with anxiety respond very poorly to caffeine because it heightens your central nervous system such that um, it may put you in a place of having an anxiety episode. And again, um, it is very, very important if you think you have clinical anxiety to talk to a healthcare professional, a doctor and mental health professionals. Self-diagnostics are not helpful, but these conditions are managed, and people can live good lives and improve their quality of life if they do manage these conditions. So yeah, that's what I got for anxiety. Um, Etham, any questions?
Thank you so much, Ernest, for this presentation. It's really, really great. And what actually catches my attention that anxiety could be good. It
Absolutely.
could make us do things, take care, watch for more details, improve stuff we are actually working on. But I think too much of it is the problem.
That's exactly it. And most mental health situations are an overabundance of something that your brain should be doing. Um, my wife is indigenous, and she's engaged in fasting ceremonies that involve fasting. And one of the things she's described is that when one is fasted, your eyesight actually sharpens. And this actually happens. Basically, your body says, "I'm starving, and I need to focus on movement so I can catch a prey item and eat to survive." Um, and this is a natural process when you're starving. This is something your body does. And maybe we should cut this part out. Um, but the point being, there's a lot of things your body naturally does that um, might seem maladaptive and overabundance, but in the moment is very necessary. In long-term survival and long-term well-being sometimes is at odds with short-term survival and short-term well-being. And that's just a part of human condition.
100%. Thank you so much, Ernest, for this information. And at the end of our session, I would like to thank Ernest Johansson, our mental health expert, for dedicating that time and effort to promote and enlightening some mental health awareness among our community. Thank you, Ernest, again. And for everyone, stay safe, stay well, and we are looking forward to see you again at another session with